Yes! It's your boy, the Crypto Lifestyle, the lifestyle where your money works for you instead of you working for money. Now guys, I have a beauty here in my opinion. This ICO, this blockchain startup company, this blockchain tech will revolutionize everything in regards to the healthcare sector. Okay guys, but before I get to that, I really would appreciate if you could give me a thumbs up, and if you're not a subscriber, I highly recommend you subscribe to my channel. Now guys, what is Medicalchain? Medicalchain is it just blew my mind, because when I thought of my personal experience with the healthcare sector, this makes it so much more easier and convenient, and not only that, it empowers us. So let's get right to it. So based on the white paper's definition, Medicalchain is a decentralized platform that enables secure, fast, and transparent exchange and usage of medical data. We use blockchain technology to create a user-focused electronic health record and maintain a single true version of the user's data. Excuse me. Now, this is the thing, right guys? When we're looking for an ICO, I always tell you there are just 4 building blocks of it. It is the community, the working platform, it is also the technology obviously, and the supply to USD ratio. Okay, there's a couple other things, but those in my opinion are the 4 fundamentals. So this is the thing as well. We could read all these texts here, like, okay, let's just read this out for a bit here. It says Medicalchain uses blockchain technology to securely store health records and maintain a single version of the truth. The different organizations such as doctors, hospitals, laboratories, pharmacists, and health insurers can request permission to access a patient's record to serve their purpose and record transactions on the distributed ledger or the blockchain, right? Obviously, the team is the most important aspect to me, and we could read these texts, but you wouldn't really get a great clear indication or wrap your brain around it for real world applications until you really watch a video. It gives you a little bit more clarity, guys. So let's get right into that. Yeah, let's watch this video so we could get a better understanding of what Medicalchain is and what it would do and how it's going to revolutionize the healthcare sector. And remember, the healthcare sector is a $1 trillion industry, guys. So I think this will be big for us investors. Okay, 1 second guys, let's watch the video.
One of the biggest problems in healthcare today is that organizations hold multiple and fragmented health records about patients. Medicalchain solves this problem by putting medical record transactions on the blockchain to create a smart healthcare ecosystem. With Medicalchain, a smart contract is launched to give time-limited access to a patient's electronic health record. Doctors write notes, add scans, and lab results, which are all recorded as transactions. The pharmacy dispenses medication and also records the transaction on the blockchain. The patient gives time-limited access to their insurer for verification of treatment and payment settlement. With smart contracts, patients reward doctors to remotely review medical cases and provide advice or a second opinion. Patients give health insurers access to their health record to monitor fitness progress and be rewarded with tokens or a reduced insurance premium. Patients are also rewarded for giving research institutions time-limited access to their health records for medical trial purposes. Medicalchain is issuing med tokens, which patients will use for storing electronic health records on the blockchain, data from wearable fitness devices, and transfer of value and payments. Medicalchain's healthcare ecosystem will be a platform for developers to build smart applications that analyze health data and provide recommendations such as nutrition and fitness routines. We are a real company driven by doctors worldwide and the blockchain community. Phase 1 of Medicalchain is already running at various hospitals across the UK. Together, we can build a better healthcare ecosystem. To find out more, go to medicalchain.com.
So there you have it, guys. So one of the points that I picked up in that video wasn't just only the technology, wasn't only just the convenience and the empowerment we would have as patients, but one of the key points was this technology is already being utilized within hospitals and walk-in clinics in the UK. So this isn't just a vision, okay? This is an actual viable working platform or prototype that's already being utilized, okay? So that is very, very massive. It's one thing it's one thing for a team to say, you know, we want to do X, Y, and Z or ABC, and you know, we're gonna do this in a couple of months from now. No, these guys are already incorporating this within hospitals and healthcare sectors within the UK, so that is massive. Okay, guys. So let's just go over, in my words, what this video is about. So as we just went over, it's a storage for electronic health records by using blockchain technology, right? So guys, think of it like this: us patients will be in control of our own health records, and we won't really have to rely on any sort of health institutions for this. Okay, so for example, you know, when I go to the, I don't know how it is in your country, but where I live, I go to say the neighborhood walk-in clinic or the hospital, and we have the nurses will go on the computers, typing it up, verifying information, asking for a health card. All of this would be stored on the blockchain. Okay, there would be no need for this anymore, and we would have to grant them access to this. They would have to ask us permission for this. They do not have it stored on their centralized system. Do you guys understand the power of this? Okay, that is huge. So, you know, we are like pretty much like the owners of our own medical records, which is that's the one of the greatest asset we have, right? That's privacy, and it's personal to us. So that is huge as well. We own that now. It's on our blockchain, and we would send it to whoever we want, and they have to ask permission. I really love that as well. You know, so what else could we look at? We have control. I guess we could look at it as, you know, we have control over our own privacy, as I mentioned. We could deny access or grant access. This is very powerful, and this is what I love that. I really love that. I'm very excited for this project. So yeah, guys, what else could we go over? Let's just actually see the team. So let's go down here. That's a very important part of any project going on, any new startup going on a blockchain. So let's check it out. So guys, this is the other thing. This is not a business guy, okay? This is a doctor. See, Dr. Abdullah. This is an actual doctor, okay? So this is not a business move. This is a doctor that's been in the industry, and you know, he saw a problem and he's trying to fill that void. First, it's a technological advancement within the healthcare sector that's going to not only be convenient, but I can't stress enough, it's going to empower us, the people, as patients, guys. That is huge. So you could check out his LinkedIn here. We got Motayab as well. You know, they all have their LinkedIn info, so you could actually, you know, just dive deeper into their resume and their past work and how much years they have in the healthcare sector. So this is really big in my opinion. This is a massive team too, guys, right? Look at this. Huge. Look, we got a video here of Dr. Abdullah. So let's just, I don't know, we don't have to look at that. You guys can check that out on your own time. So guys, let's get to the white paper and the numbers. Let's look at some of the numbers, and I highly encourage every and anyone who's interested in this project, after looking at my video, to do your own research, guys. You know what I like to tell you guys, and this is the truth: I am not a financial advisor. I am only showing you guys what's out there on the markets and my personal outlook on it and what I am doing. Okay, this is not any recommendation, guys. Let me make that clear. But I am very excited for this project. I really truly believe this will have a huge positive impact on the world and us on an everyday life benefit, right? So let us go to the white paper. So I just want to go to the white paper and show you guys the actual supply to USD ratio, which was on page 31. I mean, you guys will have to come here. I went through this white paper on my own. I don't want to bore anybody with just like, you know, basic stuff here. They do have a roadmap, obviously. I believe that was on page 31. Let me just go down, guys. Okay, what is this page? Yeah, this is it. Okay, so token sale. So here we go. Medicalchain's ICO will be a capped sale raising 24 million, equivalent of Ethereum and or BTC, Bitcoin. With white listed contribution caps, Medicalchain will be issuing 500 million ERC20 tokens or MED tokens. Okay, they are called MED tokens to create a new blockchain-based healthcare ecosystem. These tokens will be offered in a crowd sale to allow participants to purchase MED tokens early, as well as contribute and support the further development of Medicalchain. Okay, so basically this is what it is. Let me see something here. Okay, so 500 million tokens at a ratio of 25 cents. Okay, I like that. That fits my criteria. I like that supply to USD ratio, guys. We could see some gains here. Look, man, this will definitely be like, it's up to you. I could see this go to be an instant 5x at least when it goes live to the markets. But in my opinion, this is something I'm gonna hold for. You know, I don't like to hold anything for years, but I truly believe the longer I hold this, the more profitable it would be, because it would be implemented throughout various different healthcare sectors around the world globally. Okay, and that's when we will see the power of this project, guys. Now, when and how could you get into this ICO? Very important. Let us go back. And as I said, guys, there's a lot of info here, and I highly recommend you come here and do it yourself. The roadmap is here. It started quite in 2016, so this was well in the works. This is not something they just made up overnight, guys. It was well thought out. You know, in a year in advance, right? So right here, you guys could check this out. Okay, and it goes into 2019 as well. Okay, guys, so let us check this out in regards to being whitelisted. So all of these ICOs are changing, guys. You have to be whitelisted. You know, they got a private sale, they got a pre-sale, and they got the crowd sale. Unfortunately, we missed the pre-sale, and you know, you can still get in. You know, at 25 cents is still a great deal for a 500 million token total supply. So let's check it out, guys. You would click the token sale right here. You put in your first name, your last name, your email, and you know, I don't know, they want your mobile number, whatever. Purchase amount. How much would you want to invest in this ICO? And you do the basics. 1 + 2 is 3. Okay, and submit that, and you would be whitelisted. Easy as that, guys. This would be February 1st as well. Okay, this ICO starts February 1st. They do have a Telegram chat. I highly recommend you guys join the Telegram chat. Normally I make my own, but this is just, there's no need for it. They have their official Telegram chat. You guys go check it out there and ask any questions. Look at the pinned message before you check out anything. Let's just check it out right now. So they got 13,480 members, guys. There we are. This is the pinned message at the top here. I highly recommend you check it out before asking any generic questions. That is very repetitive for the admins in the group, guys. So that's all I have for you guys. I hope this was very informative. I truly believe Medicalchain is going to be a complete game changer on how we visit the doctor. It's putting power, it's putting control and power into our hands as patients, and we are the centralized figure, so to speak. You know, that's my terminology at least. Guys, I hope you enjoy this. It's your boy, The Crypto Lifestyle. Give me those thumbs up. Be a subscriber. Click that, smash that subscribe button. I'm going to be giving away Bitcoin within a week. I love y'all. I appreciate y'all. Let's make $1 million at least in 2018. And until the next video, you're on your own. Later.
My money works for me.
Well, your money works for you.
Instead of you working for money.
I got my money working for me.
My money work for me.
Wherever I go, it just goes with me. Crypto life is the life I lead.